We recently told you about the reality of human trafficking in our area.
Almost all of human trafficking victims or survivors deal with PTSD. It can be challenging knowing how to help and comfort a person who may be dealing with trauma.
Well, new at 10 tonight, Sarah Tamer tells us how a local psychologist is helping people understand what they can do.
Clinical psychologist Corey Patrick helps veterans with post-traumatic stress disorder.
Remembering to be compassionate.
Patrick says veteran or not, trauma victims for the most part experience similar symptoms, including victims of human trafficking.
Things like nightmares, having intrusive thoughts and images, remembering the event that happened, avoiding things, avoiding crowded places, avoiding unfamiliar places.
According to the National Human Trafficking Hotline, victims of sex trafficking are especially vulnerable to physical and psychological symptoms of trauma from repeated, intrusive, and long-term abuse. A 2014 study of health consequences shows 92% of sex trafficking victims deal with mental health problems. Franciscan sister Marlene Weisenbeck started the La Crosse Task Force to eradicate modern slavery in 2013. She consistently meets with several human trafficking victims and wants to gain more knowledge on trauma-informed care.
The more stories you hear, the more you begin to see commonalities in them, in the victim's response, the survivor's response, and yes, the perpetrator's evaluation of all of this as well.
Patrick says it's necessary to learn the signs of trauma to better understand how to help a victim.
When you're comforting or working with a trauma survivor, that's not somebody that you want to just hug unexpectedly because they're upset, or even like touch their shoulder or their back. You want to be very mindful to make sure that you ask permission before making any physical contact with them.
The task force to eradicate modern slavery continuously works to raise awareness on human trafficking and trauma, but Weisenbeck says there's a long way to go.
Other professionals such as social workers or physicians or nurses or teachers in schools also need to have an awareness of what trauma is and what they're seeing in a person's behavior that might indicate that they're dealing with a serious situation.
Reporting in La Crosse, Sarah Tamer, News 8.
If you have any questions or concerns or would just like to know more, you may contact the Tomah VA to talk with Corey Patrick or Sister Marlene Weisenbeck at the St. Rose Convent right in La Crosse.